why this Wilson disease happened to some person? What is the main reason behind it?
So the reason, so it is a rare disease because different people have different definitions. But if a frequency of a disease from a general population is less than 1 in 2,000, we say it's a rare disease normally. But it differs from different organizations. So Wilson's occurs for 1 in 30,000 people. That's the approximate prevalence which has been spoken of for Wilson's. It is again different in different regions of the world. But that's kind of a approximate figure which most people kind of talk about. So it is a rare disease, and it occurs because it's a genetic disease. So it is something which the child inherits from the parents, and usually it is part inheritance from both parents, which causes the disease, and this is referred to as autosomal recessive. That means you need an abnormal mutation. Mutation is a change in the gene from normal. So you need an abnormal mutation from the father and an abnormal mutation from the mother to develop this disease.
So this is a gene mutation problem, and this is, as you explain us, this is a rare disease. Is it in childhood, or at what age we can know that somebody have Wilson disease?
So if you're asking me how does a patient of Wilson's disease present, so yes, so Wilson's basically is a disease of copper accumulation. So normally, all foods that we consume, food, drinks, whatever we consume by mouth, has some amount of copper. There are some foods which have much higher amounts, some have lesser amounts, but all foods have copper. And when you ingest those foods, some of it gets absorbed in the body, and whatever is needed for the body is retained, and rest of it gets excreted from the liver through the bile into the
Hmm.
stool. What happens in Wilson's is that this excretion by the liver into the bile does not happen. So it starts accumulating in the liver. And then it also accumulates in other organs. It's mainly the liver. It can also accumulate in the brain. So when it accumulates in the brain, it causes neurological manifestations,
Hmm.
manifestations of the nervous system. And if it accumulates in the liver, it causes liver manifestations. So what are the liver manifestations? Patient may have no symptoms. He may just have some abnormal liver function tests which are just picked up incidentally. Or somebody may come with an acute hepatitis, which means presence of jaundice, loss of appetite, like any other viral hepatitis. But this hepatitis may go on for a longer time than what one expects. Or there may be recurrent episodes of hepatitis or jaundice. He keeps on having jaundice again and again, and people cannot find a reason. The common causes like viruses are not there. Sometimes they develop cirrhosis. Cirrhosis is like a scarring of the liver. The liver shrinks and the liver function gets compromised. So they may come for the first time with fluid in the tummy. The belly is big because there is fluid accumulated. There is swelling of the feet. Sometimes they may come with a blood vomit or black colored stools or deep jaundice, or sometimes effect of what we call ammonia on the brain. These are all complications of cirrhosis. So they may come with complications of cirrhosis. So it's a wide spectrum as far as liver is concerned. As far as the brain symptoms are concerned, they often come with a child who's in school, who's otherwise doing well academically. Suddenly, his handwriting changes, his handwriting becomes illegible, his academic performance deteriorates, and he starts doing not well in his class, in the exams. His speech gets altered, so the speech becomes not comprehensible,
Hmm.
it's not very clear. What we call a slurred speech. He can have drooling of saliva. The saliva may drool down. His hands and feet may show abnormal posturing, what we call dystonia, and there may also be slowness of gait. So all these can be neurological manifestations of Wilson's. Rarely they can have seizures or fits, as we call them.
Okay.
So these are neurological manifestations. So it will all depend on whether the patient primarily has liver manifestations or has brain manifestations. The liver manifestations tend to come earlier on in life, usually before 10 years of age, but the symptoms can come anywhere from 3 years of age to 55 years of age. So, but typically liver manifestation come before the brain manifestations. The brain manifestations come almost a decade after the liver manifestations. Most patients would have either liver or brain manifestations, but some patients unfortunately can have both. The other way in which we pick up Wilson's disease is that somebody in the family
Hmm.
has Wilson disease, like a child has Wilson disease, and he has two siblings, one brother, one sister. So we insist on testing the family, and we figure out that even the brother or the sister has the Wilson's disease, but they have no symptoms. But we pick it up that way because we always insist on family screening. And this is referred to as pre-symptomatic Wilson's disease. They are likely to develop symptoms sometimes later in life, but even in the pre-symptomatic stage, if you pick it up, we advise treatment.